All right, looks like it's starting to work here. One moment. Yep. All right, welcome to the Older Vermonters Caucus. Thanks everyone for being here today. We'll get started here in a minute. I just wanted to put one announcement out there that I had requested a bill to be drafted around creating a Vermont Commission on Aging. I have that bill somewhere in my email. I haven't had a chance to really review the draft yet, but I'm going to take a look at it. And if anyone wants a copy of it, just drop me an email. Once I have taken a look at them, I'm happy to share it. So, and if anyone wants to sign on as a co-sponsor, I have a couple of representatives here that maybe will join me in co-sponsoring this legislation. I don't know if do you have anything that you'd like to talk about? I know in our committee, we're looking at budget coming up. So we'll see how that goes through. I haven't really had a chance to dig into the Dale budget, but that's some of the work we're doing in the Human Services Committee. And someone's asking for the link. Okay. All right. We'll just respond to that person. I will turn it over to Commissioner Bowen and Angela, the Deputy Commissioner. Thank you both for being here today. Really appreciate your time to come in and talk to us about the work that you're doing. Welcome. I'll just turn it over to you for now. I know you have a presentation that we can share up on the screen here, and then we'll come back for questions. So thanks everyone for being here.
Hi, everybody. I'm Dr. Bowen, Jill Bowen, Commissioner for Dale, and very happy. Thank you for the invitation, Representative Noyes. We're very happy to be here today with you. So this is just a couple of highlights and some key areas that we wanted to share with you today. I'm happy to drill down in many different ways as either after this meeting or feel free to ask questions as well. So let's go to the first slide.
Oh no.
Is it not advancing?
We're going. We had this problem last week, didn't we? Okay.
We did.
There it goes.
There you
Okay.
go. If there is a day that goes by without a technical issue, okay. So Dale's mission is to make Vermont the best state in which to grow old or live with a disability with dignity, respect, and independence. And I think everybody knows that Dale is the Department for Disabilities, Aging, and Independent Living. And so we take this mission very seriously. Next slide, please. This is an illustration of just the concept or the thinking that we have in terms of a system of care for older Vermonters.
I didn't even touch it.
We are working to make this an interactive triangle where we can click on and go deeper into different sections. Yeah. So it's kind of like a public health triangle in that the bottom, which serves the most people, is your sort of more independent, lighter touches, supports in the community. And at the top would be your most acute or your skilled nursing facilities or specialty SNFs, right? And everything in between. The G's just represent the gaps that we've been working to identify in the system. The advantage of looking at it as a system of care instead of a program, sort of one-off independently over here, is that everything influences everything else. And the more work that's done in the lower part of the triangle is the upstream work that can be preventive, early intervention, et cetera. Whereas the downstream work is the most acute and intense, but absolutely necessary. We also recognize very much that we're an aging demographic. I think pretty much everybody knows that we're heading towards a third of the population being over 62. We need to be prepared to have these services and to grow the services and to be particular about which services we need to grow and to support. But it's the whole triangle that's going to be impacted. So, and it moves with each other. So every time we talk about a program or a particular program, we like to put it into the system of care and show that to people so that they see how it works within the schema, right? The gaps that we've already identified is, economic opportunity, the population changes I was just referencing, financial stability, workforce shortages, and housing options. I don't think any of that is any surprise to anyone, but the gaps will have more specificity in them. And a number of them are already identified in Age Strong. And Age Strong does help us have a system of care. Think about Age Strong as kind of an umbrella on top of this.
Sorry, six.
Age Strong.
Age strong, that's this.
Age strong.
You want to give him a piece of paper? Age Strong Vermont, which,
That's right in front of me.
yeah, the multi-year, multi-sector plan, and I believe you're going to be speaking about that in a minute.
That essentially is, you're saying is an overlay or attached to all of these.
Is embedded within the
Okay.
Age Strong plan. There isn't anything. This is such a comprehensive, such an excellent plan. So anyone had any role in it, right? I wasn't here, so I can't take credit for any of it, is amazing. It's really an excellent organizational structure. If we were able to meet all of those objectives and goals, the system of care would be so much closer to the goal of being healthy and sustainable. And I mark on the top on the right because even your system doesn't live in its own system. It lives in a wider system. And so there are intercepts we need to be attending to around mental health, criminal justice, substance use, and developmental services. That's that behind that little box.
Yeah.
Yeah. Next slide, please. So we want to, again, highlight some key programs. And then that's what we're going to do. So I'm going to start and then Angela will pick it up. So there is a family caregiver program and there are resources there. And it's really important that we recognize the importance of caregivers. So many of the caregivers for our older population are family members or friends. Many are unpaid caregivers. Okay. Right. Yes. I have also been a caregiver. So it is important to highlight and recognize because they represent some of the backbone of the supports that are provided for older Vermonters. So triple A's them have, the agencies on aging have family caregiver support staff. They provide a tremendous amount, actually, of information, referral assistance, and case management to the unpaid family caregivers. That is a lifeline, so when they don't know what they don't know, or they don't know what to do in a scenario, there is this support out there. And using the Older Americans Act funds that come through, we're gonna show you that flow of funding in just a minute or two. But the AAAs can provide family caregivers with access to counseling, training, respite services, and support groups.
So do you mind if we jump in and ask?
Yeah, sure. Go
Okay. Just I'm new and I'm trying to learn all this big, broad system. So can you give an example of an AAA? I'm from Southern Vermont, so specifically, I would recognize the name probably.
Yeah, so in-
There's so many different organizations
Yeah.
and
Right.
agencies and
Yeah,
things.
so in Vermont, we have 5 area agencies on aging. A number of them are participating today. In Southern Vermont, for Windsor and Wyndham counties, we have the Senior
Senior
Solutions.
Solutions, okay.
Yep.
All right, just checking
Yes.
if I'm on the right track.
You
Yeah,
are.
you are.
We'll also explain that a little bit more too. But yes, so the AAAs are regional and very helpful, and money flows through there, and it's nutritional programs. And well, I don't want to step on your toes. You'll get to that. There's also the Dementia Respite Grant, which is state-funded grant with the AAAs. For them to provide financial support and services to unpaid caregivers, particularly for those with Alzheimer's disease or some related dementia disorder. And that uses assessment, referral, care planning, and that helps to provide the most appropriate services, resources to caregivers. Again, for the Alzheimer's specific, there's also in-home respite, short-term residential care, and also assistive technology. So approximately 400 family caregivers were served in 2024. So it is not a small impact to support the caregivers. Next slide, please. Turning it over to you.
Okay,
Yep.
awesome. So a little bit more about Age Strong Vermont. It's a 10-year visionary multi-sector plan developed collaboratively. Dale was the primary lead, along with the Department of Health as our sister agency, really worked hand in hand in developing the plan. The work began following the passage of the Older Vermonters Act in 2020. And then we launched the plan in early 2024. It included, a whole range of collaborating agencies that contributed to the development of the plan, and a lot of stakeholder engagement, including surveys, listening sessions, focus groups with older Vermonters themselves. So the plan focuses on key areas like affordability, healthy aging, social connection, family caregiver support, housing, transportation, community design, elder justice, and strengthening systems of support. So we just completed and released a year one report. So that's what this little handout is speaking to, and we'll send the link to the year one report out to folks following this meeting when Rep. Noyes follows up. And so year one was really focused on making some progress in key areas where we saw early opportunity. And then we have some really aspirational goals in the plan too that are going to take much longer to achieve. So we have putting together implementation working groups focused on specific areas. So for example, housing for older Vermonters will obviously be one of them. And so the work continues, and we have a lot of work to do, but I'll just say the other area that we focused on in 2024 was setting baseline outcome measures. So because this is a 10-year plan, we really want to be looking at the trends over the 10 years, and are we making an impact collectively? So there's a goal tracker for those key measures, looking at things like poverty, health and wellness, and increase in housing supports or increase in transportation, for example.
And that's a link online. You can just go,
Yes.
it's available.
You mean the tracking? that you-
Yes.
Yes, the goal
It's
Great.
Yeah.
And so I know you're in the beginning of all
Yeah.
this, but how stable do you imagine the goals are in other words, the outcomes you're hoping to measure, how stable will those remain over the 10 years? Do you imagine, or is there some time built in to reevaluate and maybe adjust them as you need to, or?
So that's a great question. I anticipate the outcome measures will likely stay stable. Most of them, there might be some changes, but measuring things like, poverty and income stability, while the objectives and strategies to get there may shift along the way.
Sure.
That is probably still going to remain the goalpost that we're trying to measure year by year.
Okay. It just was, things with it, changes in administration, changes in the world. I mean, things can move and change so
It's
fast.
not inflexible.
Yeah,
You
Right,
can be
right.
inflexible in a 10-year plan,
right.
but the goals and the objectives are very commonsensical. You want as many people as possible to be able to afford to live where they choose to live, for example. Yeah.
Exactly. Right. A few other highlights from 2024 include new grants through our Global Commitment to Health 1115 waiver that were provided to the area agencies on aging to expand home delivered meals to more older Vermonters, specifically those who are the most food insecure. So we took $1 million that the legislature had appropriated in 2023 And we converted that to global commitment funds to be able to bring down the federal match and have $2.3 million to be able to expand home delivered meals. Another highlight from 2024 is that we have new adult days. So this is spilling into 2025. We have new adult day centers that are under development that we're really excited about. 2 closed in 2020 in Washington County and Rutland counties. And we have new adult day centers in the works in both of those areas. So that's exciting. There are 11 adult day centers across the state, and those regions have been without them for 5 years. We've also been participating in a multi-state collaborative, specifically around supporting the direct care workforce, right? So when we talk about our system of care and how we ensure a stable system of care, it's our family caregivers and it's our direct care workers that are really the foundation for that system. And many of our provider agencies, home health agencies, designated agencies are really struggling with that direct care workforce. So we've been participating in this national collaborative to look at real strategies and what's feasible for states to do in terms of supporting the direct care workforce. So for example, we have direct care worker marketing campaign coming out in early 2025, soon, I believe. That'll really be not only trying to recruit more people into this workforce, but really elevating the value of this workforce as well.
Just a quick question about the multi-state nature of that
Yeah.
collaborative. Is that just so you can get ideas from people and how they're doing in other states? Or are you actually looking to do some workforce recruitment across state lines, or is it just idea generation?
It's really it's learning across states. It's also hearing from national experts, and being able to take ideas from other states primarily. I don't know that there could be cross-state recruitment. We've had a lot of discussions in northern New England about really trying to pool supports and do this collaboratively.
A lot of best practices
Yeah.
sharing and lessons learned.
Right, exactly.
Smart.
And then last but not least, we worked with a team from the Vermont Certified Public Managers Program to develop a social connection map. So I'm going to pop over to the next slide because this is a really cool resource that could be great for constituents as well.
So my internet just bumped.
Oh, okay. Let's see if we can get it back.
talking.
I'll keep talking. The social connection map, which is really, because that's one of the key goals in the Age Strong Vermont plan, is to try to address the impacts of social isolation and create more connected communities, knowing the health impacts that isolation has on everyone, but in particular older Vermonters. So the social connection map shows places where older Vermonters can gather across the state. So you can look up your area agency on aging, senior center.
All right. Go.
Okay, senior centers, adult day centers, memory cafes, food distribution sites, meal programs, as well as libraries and town centers where a lot of people gather as well. So it's a great tool to be able to use to spread the word around where people can gather. So click at the top.
Yeah, wait, no, go back.
I'm gonna try, but it may be, nope, it doesn't want me to click at
No,
the
don't
top.
click on there. Click on the
Yeah.
actual words,
Yeah.
not the link.
Up there where it says social connection map is a link.
Right here.
I hope it comes up because you can see it's really good. Is this
Oh,
actually, are you on now? You're actually in it?
Rebecca's in it, but you're not sharing your screen.
I am sharing the screen, so, but not this screen. So you know
Right.
what, you're all gonna have to play with it on your own. I think it's probably
I'll make
easier.
sure the link goes out so
Switch
people can
it.
take a look.
Share your other screen.
Stop and come back.
So just as just so you know how amazing that link is, I hope that she can get it up and have you see it because it's the kind of interactive map I was saying was under development for. I mean, you can click on and what comes up, depending on what you're interested in, is all the sites for that service in one. And you can click on a specific area, perhaps in your area, click on an area. Oh, here it is. It's better than my talking it through. I'm sure you had an image in your head. Did it look like this?
So here you can see, if you, down below, you can see specific things. So she clicked on Adult Day Center and all the adult days around the state pop up. And then if you go to each of them, not only will you get an address and a phone number, but a description around what they do.
Right, click on one of the, just click on one of the dots.
There you go.
Now it tells you about that particular program.
Right, right. And, you know, the maps also can be helpful in that they show us where there are gaps as well. So you can see that there are regions of the state that don't have access to adult day services right now. So it can also be a tool to look at where, you know, where are we strong and where do we need to improve in terms of access to services.
Also on the left, you can sort by, if you're interested in medical oversight or a health clinic or meal or personal care, it'll then give you, it'll filter for you basically. So you can, makes it easier for you to find what you're looking for.
Yeah. Thank you, Rebecca.
Okay.
Good job, good job.
Goodness.
Well done under pressure.
It's really a
Go back to
community
this one.
program finder. I mean, it's
Yes.
Great.
And we hope it'll be, you know, a living, breathing kind of tool as well that we can, you know, keep updated and evolve as we do this work. So next, I think we were going to talk about the Older Americans Act and just a little bit about the funding that we receive from the federal government and how that funding flows.
We'll get there, folks. Sorry about that.
It's okay. So Older Americans Act funding, we receive in Vermont about 10 million in federal funds, federal Older Americans Act funds for all the Older Americans Act services. So that includes not only nutrition services like home delivered meals or congregate meals, but that's information referral and assistance, case management, transportation, legal assistance, also family caregiver support, health promotion and disease prevention support, a real variety of services. Then, but most of that funding, over about 6 million of the 10 million, is for nutrition services.
May I ask, just how do those funds originate from the feds? Do you have to make application? Oh, you're getting ready.
well, you're just going to see the flow of money into.
Yeah. Yeah.
Okay.
So, yeah. So I'll also say too, before I talk about flow, that the state contributes a significant amount of funding towards Older Americans Act services as well. So there is a required state match, but Vermont contributes above that state required match. So the state contributes about 6.5 million in general funds towards OAA services as well.
What is the required match? Is it half?
No, it's 15% for some services in the Older Americans Act and 25% for some.
Service.
Yep.
I see.
Quite a bit above.
Yes. Yes.
Hi, good afternoon. Do you guys work with the senior centers also?
Yes, we do. Yep. Primarily, it's the area agencies on aging at the regional level that work closely with the senior centers in their region. They're providing them, you know, often with funding to be able to do meals at that senior center, also with programming and that type of thing. But Dale also works with the Senior Center Association as well.
I didn't know that. I'm very new at this.
Yeah.
I'm very involved with the Brandon Senior Center.
Oh, I love the Brandon Senior Center. They do it great.
I was
a
up
great
there too,
job.
and
Yeah.
listening on my listening tour. It was excellent.
Great.
Kathy Mendes does a great job.
Yeah,
She's
she
a friend of
does.
mine.
Okay. It's good.
So in terms of funding flow, the Older Americans Act is authorized by Congress, and so it's subject to the annual appropriations process. Yes. And so when Congress appropriates the funding for Older Americans Act services, it's administered through the ACL, which is the Administration for Community Living, which is part of HHS, Health and Human Services. ACL then distributes that funding to states. So in Vermont, it's Dale, and Dale administers that funding and distributes it to the 5 area agencies on aging in the state.
And if I may, Dale is the state unit on aging for Vermont.
Correct.
And just as if you look on the Older Vermonters Working Group, when we were putting together for creating the Age Strong Vermont plan, Angela did put together a wonderful presentation that's on there of how the Older Americans Act works and all of the pieces and parts of it. It's on there. I just looked. It's still there. It's like the September meeting. Anyways, I will include the link
Yeah, I
to
was
it.
gonna say maybe-
So it's a great presentation that really kind of goes through the Older Americans Act and how all the pieces and parts fit together.
Thank you.
So
Perfect.
There's different titles that are
Yeah, focus
reflected
on-
into,
Exactly. Okay.
and then it goes to the AAAs, who then distribute it.
So of the but of the $16.5 million that you're working with, how much of that finally ends up in the hands of the AAAs?
Both the federal and state. So basically, how much does Dale hold back?
I guess
How
that would
much
be,
is- how
yeah.
much
There
is
obviously must be
distributed to the
administrative issue. I don't know how this works, so just,
Yeah, I don't have that number off the
Okay.
top
Can
of
get
my
that
head.
number.
We can.
Okay,
we
just
can
Most
get
of
it.
it moves.
The vast majority of it goes to the AAAs.
Okay.
We have our staff is pretty small.
Skin.
Are there any programmatic aspects that Dale runs and it doesn't get to the AAAs?
We are, aren't we?
The Long-Term Care Ombudsman Project, yes.
Okay.
Yes,
Legal aid.
which is also funded by the Older Americans Act,
Okay.
correct?
a portion of it.
Yeah.
Put some money in as well from general.
Yes, general fund,
Yep.
global commitment, and Older Americans Act are the primary
I
funding
see.
sources for the ombudsman. I think.
We'll get there.
Question.
Does, if there's a community center in your town and most of their clients are older folks, do you work with them directly, or how would they avail themselves of any of the expertise and services out there?
Yeah, what we would do would be to connect them with their regional area agency on aging for a conversation around what they're trying to do. Is there support available, making those connections for programming or services? So I know we have area agencies on aging on this, on the Zoom today, who could speak more about how they work with the local community centers and organizations.
And we'll have them in for one of the caucuses for sure to kind of give an overview of the work that they're doing. And just one thing to point out, in the OAA and the money, the way it's currently set up, there's no direct money that goes to senior centers. However, in the reauthorization, there's kind of the framework to eventually have that happen, although it's not reauthorized at this point, and it's just in the continuing resolution under the federal funding that's coming in now. So I don't know if you'll talk to that, but okay,
That
there it
next
is.
bullet.
Right on.
Are we back to you, Jill?
So the OEA appropriations, as Rep. Noyes is saying, they're part of an annual process, and they are in the current continuing resolution. They didn't get through or authorize, even though they were pretty much on track to do so. But with the last minute, push that happened at Congress, it actually didn't get through. So it's in the resolution through March 14th or 15th, which means it's continuing to be funded through March 15th. two separate things. One is the reauthorization and the other is the appropriation, right? So the key here is to have the appropriations. Of course, we want the reauthorization, but historically, sometimes it went for a while without a reauthorization, then got picked up again, got reauthorized. But it has been getting the funding, and that's the key. So we really don't know until March 15th, and they start to figure out the next steps post the continuance. But we've been working with the federal delegation, and others have been supporting and paying attention to it. So we are keeping an eye on it. And what I just said, the second bullet, that we are working with our agency and all that with to certainly pay attention to what that might end up resulting in. Yeah, and putting, thinking about what a plan B or C or D might be. We are hopeful that it makes its way through.
It will continue.
Yeah, definitely with what's been happening. There's been a lot of the agencies provide services to older Vermonters that are very concerned about the funding stream and really asking questions about how much we've drawn down, how much money has the feds authorized that we've been able to bring into the state where we can, hopefully make sure these programs are strong and funded so that older Vermonters have access to services. Is this something that you're paying attention,
Yeah. We've drawn down everything that we can draw down. Remember, it's on a federal cycle, right? That would be the federal financial year goes to October, right? Or starts in October. And so there, the percentage that was authorized and funded through this up until March 15th, we've been able to draw down.
Okay, that's good to hear. Is this something that the agency is keeping, just as you hear stuff, are you able to let us know in terms of what's going on at the federal level with your connections federally? I know that's a real big concern about, shutting off the payments, turning them back on. I'm just wondering what you're hearing, and you probably know nothing more than we do at this point, but as stuff comes up, it would be really good to have those lines of communication open, because we talk to our constituents and a lot of the agencies provide services in our districts, and just making sure they have a place to ask questions and to be able to maybe quell some of the fears that the world is ending, because hopefully it's not.
Yeah. So we appreciate for everybody that it's difficult when there's uncertainty. And we work very closely with, our agency and the state in general. And so there's a lot of collaboration. There's not fragmentation on this, departments this. So it's really a very much of a working together to make sure that everybody has the information they need, but also to realize that right now it's pretty business as usual, right? We need to be focused. We need to continue to do the work that we do to serve the people that we serve. And the uncertainty is a reality right now that we need to sort of work through and manage. Yes, we keep our eye on everything as information comes up, but it is a shifting, landscape. And so we don't know what we don't know until we know it. So head not in the sand, but also not overreacting to something that at the end of the day is just uncertain.
True. Just want to, I see Mary has her hand up. Mary, do you have a question? Trying to keep an eye on two screens in the room. So sorry if you've had it up for a while.
Yes, thank you. I just wanted to go back for a moment to the Older Americans Act program funding question that came up and the area agencies on aging. And so most of our funding through the area agencies on aging is sent out to our local community partners to deliver services. One exception is for the caregiver program, which you heard about earlier, which we have direct supports for the caregiver program, but those programs you hear about, like supporting Meals on Wheels through community meal sites, senior centers, and wellness and activity funding, and other supportive services are passing through funding to those community organizations. So if your community organization is interested in delivering something along those lines, then they should reach out to their local AAA.
Great, thank you. All right.
So let's go on to the next slides and cognizant of time. There we go. So another
Mary Alice
item-
is waving her hand. Sorry.
Thank you, Mary Alice. I didn't even see you up there. Sorry.
Yes, well, I don't have an automatic hand thing to put up. I have to put up my real hand. But I just moved to a community care home down in Rochester, the Park House, and I get my meals free, and I have problems walking. I'm a consumer on here. I'm very interested in H13, which just came on. And I want to make sure that Quintown, which is a little area that consists several different area agencies on aging, get some contention, because we're right in the middle of all these other bigger places, and we're on Route 100 and right in the middle of the state, and I don't think we're getting the services that other places are getting. So I just wanted to put that out there and let everybody know that I'm concerned. And I hope that H13 does pass out.
All right. I'm pretty sure that we're going to be working towards that in the Human Services Committee, and appreciate you talking about Quintown and the amazing work that they're doing. But thank you.
Thank you.
Thank you.
So I'm going to talk for a minute about Mission Care at Bennington. For those who are not aware of what Mission Care is, it is a new specialty care facility. It's a nursing home, skilled nursing facility, but it's the first one in Vermont that is for complex needs. And that by complex, we include the physical health challenges, the mental health challenges, and for folks who are justice involved. And before Mission Care opened in Bennington, folks who needed that level of care, and that is a growing number, in part due to demographics, part due to the fact that there's just increasing complexities in the system that we're aware of, is that many of those folks were stuck at levels of care that didn't meet their needs. Because there was no place that had the skill set or the combined skill set to provide that level of care. And it's actually an average of 443 days that they were sort of stuck in a different level of care. And 443 is the average. It's 435 days for those who were in a hospital. Like, they were ready to be discharged, but there wasn't an appropriate place for them to go. So they were in some ways backing up beds, but also not getting the services that they needed. And for those who were coming from a psychiatric hospital, that was 682 days that they were waiting. For those who are coming out of the criminal justice system, the two who have so far been admitted are spent more than 20 years in the correctional facility. So these folks have now moved into a setting. The first person they took in September was someone who met all the criteria. Remember, this is a nursing home. So first and foremost, you must meet eligibility criteria. You have to be choices for care. But that person was experiencing housing insecurity, was actually in the hotel system. And so with all of those kinds of complexities, what Mission Care has, and they had one facility in Massachusetts and another one in Connecticut. And we went out and looked at them before they opened here. And this is what their specialty is to have the complex care, and to sort of embrace that that's how they are going to be, this is the population that they're going to serve. So they took over the Bennington site. It is 91 beds. Those who were there before were welcome to stay, and all of them chose to stay. Those who were working there were offered the opportunity. They all stayed, and now they are hiring up. Over the past few months, they've been pretty successful at hiring, relatively speaking, because it is very, very difficult, challenging, the workforce shortage in nursing home. But they have brought people in. I got a chance when I was out there to speak to some of the people who were in one of the onboarding classes that were joining. And they said they wanted to come work there because they were excited about a new model, because the folks who run this at iCare are very present and supportive of the employees. The people who are being served there in the nursing home itself have very positive things to say about the experience. So we're very pleased to be able to have a site like this and to be able to move folks along. And we also have heard from the hospitals, like here's an example, Rutland Regional Medical Center. They now have the capacity to reopen their ICU, which was blocked up because there wasn't flow through the system. So just an example.
Glad to hear that's up and working. We definitely, over the years, have been waiting for that to happen. So glad that's up. Put a lot of money into it for sure to get it going.
Well, we recognize that. And also, that the offset with the cost to the hospital system is not inconsequential, and the level of service. But again, it sits in a system of care, and we need every level of the system of care to be flowing with each other. So this is mission care.
I do want to just be respectful of people's time here. We have committee in about 10 minutes, so we're going to have to go back, but okay.
One more slide. This just speaks to our proposed budget, and the one thing that is coming in the budget that is new is conflict-free case management. That shouldn't be new to anybody because it's been rolling and developing for years. It is absolutely required by the federal government. It is, I think, the last one in the country to roll. And it is includes choices for care case management, which is the whole point of this conflict-free, is to separate out those who provide the service from those who do the case management, right? And so that shift from the home health agencies is well underway to the area agencies on aging.
Yeah, and I saw those line items in the budget, so we'll be taking a look at that.
Yeah, I mean, we certainly will talk about that, and also just funding in general for nursing homes is something that we would expect to be in the budget. Yep. And that's us. You can turn next. This is just who we are. Feel free to
Awesome.
out. And I think we have a last slide that says thank you.
You're welcome.
I do have one question in the chat that I just thought I would highlight. Are you with and we kind of touched upon some of this, but have you been looking at any emergency planning? Like, what happens if the OAA is not reauthorized in March? What if the funding doesn't come through? Are you doing some contingency planning around that to make sure that the most vulnerable in Vermont have access to services? And
yeah, like I said, so we are paying attention to it and are considering what would the options look like in the event that X happens or Y happens. But the fact that, X, Y, Z
Right.
happen makes
month
it
and a
hard.
half.
Right. But you do look at, and again, it's not Dale working alone.
Yes.
It's the AHS and the state and, St. General. And it's really coordinated effort to, really try to figure out, what would be the plans beyond that. And I don't think that, given the uncertainty and the changeability with, as things are flowing, it's not like, oh, here's a plan. And here's a plan, but there is a general look at what would be, possible. But the whole idea is to not let us get ahead of what the reality is on the ground.
And I know Treasurer Pichek has put together a group that's been starting to meet, and I've invited him to come to the Older Vermonters Caucus and talk about some of that work to see what they're, how they're planning, and just really thinking about how we have the financial means to keep these agencies going, depending on what comes out of Washington. So that will be coming up as well.
Yeah.
They are, I know they're meeting today at 2:00. So, but I got something else going on. So, all right. Well, thank you so much for coming today. Really appreciate it. I did just want to give a quick update. We have some legislation exempting the tax on Social Security over a period of 8 years. That is in the Ways and Means Committee right now. The governor did include increasing the exemption by 5,000. Our initial in that 8 year was a 15,000 and then 12 and then 10 until it goes up to the end of the 8 years, which would basically exempt Social Security from state tax here in Vermont. So I did want to point out that there is money in the budget to kind of get that going. And we'll be hoping that we can get some movement on that bill this session for sure. And then, of course, Vermont Commission on Aging, which I spoke about at the beginning. I'm happy to share that out once I have a final draft. So, all right.
We look forward to looking at that.
Yeah, thank you. All right, everybody. Thank you so much for being here today, and we'll see you all soon. Take care.